Alright, team. We have a patient presenting with polymyositis, golfer's vasculitis, and irritation. What's your diagnosis?
I think it could be dermatomyositis, considering the muscle weakness and skin rash.
I'm leaning towards systemic lupus erythematosus due to the joint pain and skin issues.
I'm thinking it might be rheumatoid arthritis with these symptoms.
I believe it could be Wegener's granulomatosis. It matches the symptoms.
You're all wrong. It's autosomal recessive polycystic kidney disease. We need to act fast.
But that doesn't match the symptoms at all.
Are you sure about this, Hawks?
I'm not convinced. Maybe we should run more tests.
I don't think that's the right call, Hawks.
I don't give a damn what you all think. We're going to perform an esophagectomy. It's the only way to save the patient. Now move.
How does that relate to the kidneys?
This will force the patient on a steadier diet of liquids. No more tempting trips to the buffet, and this should help the kidneys.
So why not just recommend that they follow your orders to eat healthier?
Because if there's one thing standing in the way of free will and health, it's the esophagus. Now, prep, damn it. Tracy, you called me in here. What's the issue?
Hawks, I heard you wanted to perform an esophagectomy on a patient you believe has autosomal recessive polycystic kidney disease. Are you sure about this?
Of course I'm sure. I have years of experience, Tracy. Stop questioning my judgment.
Hawks, this sounds medically unnecessary.
Look, do we want to save the patient or let them continue making the same mistakes that gave them this kidney problem in the first place?
Autosomal recessive polycystic kidney disease is genetic.
So is the esophagus. We need to help them immediately.
Oh no, the patient's vitals are dropping. We need to act fast.
I told you esophagectomy was not the right treatment for autosomal recessive polycystic kidney disease. Hawks should have listened.
We need to figure out the correct treatment and fast. This patient doesn't have much time.
Definitely not. Hawks is a complete tool at this point.
At this point, he does this so damn frequently that he was probably a tool at the moment of conception.
What the hell were you all thinking? Autosomal recessive polycystic kidney disease.
That was a misdiagnosis. An esophagectomy. Are you trying to kill our patient?
It was your idea, dickhead.
You all are a bunch of incompetent fools. I'll tell you what the diagnosis is, but don't expect me to clean up your messes ever again.
We're sorry, Dr. Hawks. Please, just tell us what we got wrong.
You got everything wrong. The correct diagnosis is Hirschsprung's disease. You imbeciles, now stay out of my way and let me handle this.
Hirschsprung's disease? How'd you pull that out of your ass?
We'll make sure to be more careful next time, Dr. Hawks.
We'll do better, we promise. Thank you for setting us straight.
Don't thank me. Just do your damn jobs properly for once. I'm out of here. So, how are things in the oncology department, Johnson?
Actually pretty good. Most of my patients are responding well to treatment.
That's great to hear. By the way, have you seen the latest lab results for my patient? Something doesn't add up.
I haven't checked yet, but I can take a look later if you want.
No need. I think I may have just figured it out. It's a rare condition that mimics more common symptoms.
Really? That's impressive, Hawks. You never cease to amaze me with your diagnosis skills.
Thanks, Johnson. I better go and inform the patient. See you later.
Wait, you're just gonna leave like that? No goodbye or anything?
Sorry, Johnson. Duty calls. I'll catch up with you later. Sorry I'm late. Had to take care of something urgent.
You can't just barge in here without proper gear, Hawks.
Say safety hazard. You know that.
What's going on, Hawks? Why are you so worked up?
Listen up, everyone. I've reviewed the case and I'm confident it's not polycystic kidney disease. It's chorea, acanthocytosis.
Korea. What? Are you sure about this, Hawks?
Absolutely. Dr. Johnson and I discussed it over lunch. The symptoms align perfectly.
Well, what's the prognosis then? Do we have a plan of action?
Prognosis for chorea. Acanthocytosis is not great. It's a progressive condition with limited treatment options. We'll have to focus on symptom management for now.
Well, that's great news. We ripped the fucking esophagus out for no good reason, Hawks.
I don't see how that's my problem. I can't believe I was so wrong about the diagnosis.
Don't be too hard on yourself, Hawks. You found the correct one in the end.
It wouldn't have been an issue if my team wasn't full of incompetent doctors.
Hold on. You were the one who made the initial mistake.
Well, maybe my team's lack of support led to my error.
That's not a valid excuse, Hawks. You need to take responsibility for your actions.
I am taking responsibility. I'm suspending myself from working in this stupid hospital for a few days so I can think about what I did.
That's just a vacation with extra steps.